Why are you more likely to experience depression after you quit smoking? What is the relationship between your mental health and smoking cessation? Hello everyone, this is Dr. A Addiction Specialist. For more helpful videos, subscribe to this channel and hit the bell notification so we can continue to offer you free tips and resources on how to quit and stay smoke-free. Smoking is more common amongst people with mental health conditions such as depression, bipolar, schizophrenia, anxiety, PTSD, and ADHD. In the United States, about 3 out of every 10 cigarettes smoked by an adult are smoked by people with mental health conditions. Adults with depression are twice as likely to smoke as adults without depression. Doctors, however, don't know exactly why smokers are more likely to experience mental health conditions. Self-medicating with nicotine is not a treatment for mental disorders. The best way to feel better is to quit smoking and get the right help for your mental illness. It is important to know that if you already have depression, smoking can make this worse. This means your depression can improve when you stop smoking. Also, smoking can affect the medications you take for your depression. It is shown that people who have stopped smoking are generally happier than people who smoke. So why do some people feel depressed when they stop smoking? Well, the fact is that some people feel worse before they feel better. I'll explain why. Let's talk about what happens in your brain when you smoke and when you stop. As a smoker, each time you smoke a cigarette, nicotine goes to an area of your brain called the reward center. This causes the release of a brain chemical called dopamine. Dopamine is a chemical that your body releases naturally to make you feel good. As you continue to smoke, your brain stops releasing dopamine naturally and only releases it when you smoke. This means you only feel good when you smoke. So it seems like your happiness has been hijacked by smoking and is only released by a cigarette. Also, your tolerance to nicotine increases. This means after a while, you may not even feel good when you smoke, but you continue just to feel normal. When you stop smoking, your body removes all the nicotine within about 5 days on average. At this point, your body is not producing dopamine naturally like it was, and you're also not getting dopamine release from nicotine as you're no longer smoking. Because your dopamine release is low, you may feel down for a few weeks. Even if your mood is low, please know that this is the first step to getting better. Know that your body is in a healing phase. Over time, your body will begin to produce dopamine naturally without nicotine, and you should see an improvement in your mood. This process varies from person to person but can take 1 to 2 months on average. To help you feel better after you quit, I always encourage people to exercise, eat healthier, sleep better, engage in activities like yoga, meditation, massage, listening to music, and spending time with people you love. If your depression persists or if it is severe, please follow up with a mental health provider. There are various treatment options available for depression. Medications are one of the options, and there are several classes of antidepressants. Therapy, either alone or as an add-on, goes a long way in helping with your mental state. Utilizing the various tenets of lifestyle medicine can also help with your mood. These include exercise, nutrition, sleep, stress management, social connectedness, and avoiding risky substances. Other depression treatments like transcranial magnetic stimulation (TMS) and Spravato treatment are also now mainstream. Prime Psychiatry is an outpatient clinic located in Dallas, Texas, and we offer all of these depression treatments. There are many such treatment sites, and it is important to follow up with a treatment center if you struggle with depression. Sadly, depression can sometimes cause people to think about hurting themselves or others. If you ever feel this way, please attend the nearest emergency room or call the National Suicide Hotline. In the US, the National Suicide Prevention Lifeline number is 1-800-273-8255. If you have found this video helpful, share it with others who may find it beneficial. I'll speak with you soon.